Okay, wonderful. Yes, I'm Caitlin Giles McCormick here from the New Jersey Economic Development Authority. I want to thank you all for joining us this morning on our discussion about different grant opportunities that are working to advance maternal and infant health here at NJEDA, from NJIF and CSIT. And I want to go ahead and introduce our first speaker today. We are so grateful to have the President and Chief Executive Officer of the newly established New Jersey Maternal and Infant Health Innovation Authority, Lisa Asari. Lisa, if you go ahead and say a few words. Thank you so much.
Sure. Thank you for having me. Thank you for having me. Greetings, and thank you for having me here. I am Lisa Asari, the CEO and the president of the newly established Maternal and Infant Health Innovation Authority, MIHIA, that we call for short. I'm delighted to participate in this webinar and to share more with you about MIHIA and our role in driving innovation. MIHIA is really the big house charged with leading the state's efforts to coordinate, promote, and implement education, policymaking, research, innovation, perinatal workforce development, with a particular focus on eliminating disparities in maternal and infant health. We have been established within the last 2 months. We were established on March the 27th, and we work in partnership with the EDA, specifically around innovation to launch the incubator and innovation space within the Trenton-based Maternal and Infant Health Innovation Center. So MIHIA is the first and the only of its kind such state authority in the entire country. We are really expected to have influence on the local level through the Innovation Center in Trenton. We're expected to have influence statewide through many of our Nurture NJ initiatives, the strategic plan around maternal and infant health that was launched by the First Lady. We're expected to have national reach, and we're expected to have global reach as well. And so it's really important that we include innovation in these activities, because we know that the things that we've done traditionally have really not worked always, and we really want to lean into the space of innovation. So the incubator part of the Innovation Center will support early startup organizations that are developing and creating technologies aimed at improving maternal and infant health outcomes. We're excited about this innovation space. We're excited about the opportunities that technology presents. We're excited about the opportunities that artificial intelligence presents, and many of the opportunities that you all, our potential research partners and our innovative partners, will really uncover and unveil. We at MIHIA really partner with many partners. We've partnered with organizations like the Community Health Acceleration Project, where we hosted Princeton students in a class on maternal and infant health. But I share that with you because there was many innovative ideas that came out of that class. I presented to them, and they presented to us, myself, the First Lady, and the Commissioner of Health at the end of the semester about many of their innovative ideas. We hope that ideas like those and many others will land at MIHIA. We are really leading in the nation, being the only such authority, like I said, the first and only of its kind. Many of our other state partners are watching New Jersey to see what we can do. So we're really, really excited to be able to partner with the EDA and CSIT, and many of you around these innovative partnerships. So we look forward to this partnership. We welcome you as stakeholders, and we really want to lean in together with you to this space called innovation, to these innovative spaces to really drive progress as related to maternal and infant health equity. So thanks for having me. I will be here with you for this session, but really excited about the potential partnerships that will come out of this initiative. Thank you.
Thank you so much, Lisa, for those words. So we're super excited about MIHIA, the new Maternal and Infant Health Innovation Authority. Like she said, first in the nation. So we're definitely leading in the state of New Jersey in maternal health and advancing maternal health equity. So I'm Pamela Taylor, and I'm the Senior Advisor for the Maternal and Infant Health Innovation Center. I'm going to speak more about the center later, but I want to just root us in some statistics and just level set really quick, and why innovation is important and why it's specifically important in advancing maternal health. So you see here that we have a wide spectrum of just outcomes in maternal health, from uncomplicated pregnancies that looks like a smooth, safe delivery, mom is healing well, to maternal mortality, which is mom unfortunately passing away within that year of giving birth. And in the state of New Jersey, we rank 27th in the nation for maternal deaths. We have gone up. You know, we used to rank 47th, 49th in the nation, but now we're at 27th. We still have a lot of work to do. Although this marker is changing, our racial disparities look very different for a Black woman giving birth in New Jersey, our Hispanic woman giving birth in New Jersey versus a white woman giving birth in New Jersey. So we definitely want to support innovative projects that can help decrease the racial disparity gap that we're seeing in these outcomes. So some of the top leading causes of maternal death in the US, you can see cardiovascular, other non-medical cardiovascular conditions, infections, hemorrhaging, and in New Jersey, these causes correlate. And a lot of these maternal death causes are preventable. So we're really looking to partner with companies. We're looking to partner with individuals, entrepreneurs that have a desire to close these gaps and have a desire to help us move the needle forward in advancing maternal health equity. So you can go to the next slide. I like this slide because, a lot of people ask, why are the racial gaps so bad? Why are we seeing this? And it's a lot of factors. It's a spectrum of factors, and a lot of them have to do with the social determinants of health, where people live, work, play, eat, exist, right? So housing, food, transportation, social economic status, education, etc. And you see here, just there's a lot of different touch points for women are birthing people in the state of New Jersey, where they can either experience maternal morbidity, or just complications pre-giving birth or after giving birth. So before birth, it looks like, patient and family factors. What's the age of the mom? What conditions is this pregnancy, is this woman or birthing person in their pregnancy? Do they have secure housing? Are they couch surfing? Do they have secure food? It also looks like, during and after labor, what are the providers are they connected to? Are they going to their postpartum visits? Do they hear, heard, or that their concerns are being heard by their doctors? Are they receiving quality of care? And then also up until a year after birth, are they continuing to, take the baby to the hospital? Are they checking in on themselves? In New Jersey, some of the leading causes of like just maternal deaths is postpartum depression and mood disorder, suicide. So we want to make sure like that moms, even after birth, are being taken care of. And I think this slide is important to show because we get a lot of questions of like, what are all the factors? And the answer is that there are multiple factors and why we see the maternal outcomes that we see. But we want to work in partnership with MIHIA, in partnership with CSIT, and in partnership with our innovation fellows to move this marker forward. We can go to the next slide, and I'll pass it over to Michelle.
I was on mute. Thank you all for being here. Thank you, Pamela, for passing the torch over to me. My name is Michelle Martinez. I'm here with the EDA. I'm here with also my colleague, Milton Urgules. We work on the venture team here at the New Jersey Economic Development Authority. Our primary mandate is really to facilitate private and public investment in order to facilitate venture investment in the innovation ecosystem within New Jersey. I know that is a lot, and we really don't have time to break down all that necessarily means, but within our role today, we'll really talk a little bit about the innovation happening in the maternal infant health space, as well as startups, as well as how New Jersey Innovation Fellows, our grant program, helps to facilitate innovation in this space. And so, Pamela, the slide before, I want to actually go back for a moment to talk a little bit about the spectrum of factors in maternal health outcomes, because this slide it's actually condensed even more, because this is just as much as we were able to put on the slide. But if you could imagine, for everybody that's in the audience and anybody that's necessarily listening, in terms of the social detriments of, maternal and infant health, look at where all of these existing spaces are and really try to soak in and understand where some of the gaps are. I know, as a birthing person, as a person who has known people that have given birth and has many children around them, that there are a ton of gaps in, the provider and the facility factors, the system factors, which have historically disenfranchised women, and particularly women of color. And so you have a number of community factors and a number of norms and things. A lot of gaps exist in a lot of these spaces. And so, as you could imagine, we're only, really taking a look at maternal infant health as a general outcome and kind of what happens and from birth, from pregnancy up until I think a year or two, after birth. And so this is really only, this portion of these outcomes. But as you can imagine, these have lifelong impacts just across the board. And so really, before we get too ahead of things and for us to really get grounded as we go through today's presentation, I really invite you all to take a moment to acknowledge really all of the individual and countless lives impacted by the loss of life related to the negative maternal and infant health outcomes. All of these deaths can be preventable. Most of them can be preventable. And I ask you today to really just all consider strategies within your personal and professional influence and power to improve maternal and infant health outcomes in New Jersey. And so in terms of innovation in the maternal health space, we wanted to really provide you with an example of what this is necessarily looking like in 2024. What does innovation look like in maternal infant health outcomes, really? How are people responding to the gaps that we previously talked about by creating solutions for people to overcome those problems or those issues or those gaps? And so you really have a range of applications and innovations happening in this space across the board. Whether it's related to the holistic wellness of the mother and infant, whether it's related to the genetic testing or fertility and conception, mental health being, a huge one. You have people setting up companies that, really are trying to impact this space. You'll find a number of startups on this slide themselves that are actually New Jersey-based companies. For example, we have Latigia here, which is a New Jersey-based company. We have Neonor. Some of these companies have actually been funded through the Commission of Science and Innovation and Technology, which Maku will talk about a little bit earlier. LV, for example, if any, breastfeeding mothers out there, that's the brand that provides the breast pumps. ULA is another really interesting one, and this isn't a New Jersey-based company, but this is a network of doulas on an application where birthing peoples can get on and find access to doulas and advice and pay for memberships. And so it creates that, the education and support around birthing and maternal infant health. For example, you have Owlet, which they provide kind of heart monitors or cardiovascular monitors for infants. And so you have, what you have really on this slide is a culmination of all of this, what is considered femtech, more or less technologies that are really centered around care for women and for infants. And so that's, again, across nutritional health, across mental health, during pregnancy, immediately after. And so again, when you consider, all of the gaps that, are on the spectrum of factors, you then have, all of, these companies responding to these gaps. And so again, for all of the researchers and, potential, innovators that are on the call today, regardless of what you're necessarily doing, is there some way of being able to impact maternal and infant health outcomes through what you're necessarily doing. And that's the one thing that I would absolutely encourage you all to really consider. And so, excuse me. So let's talk a little bit about early stage support. Making the leap from, for example, a birthing person who realizes that there is a gap to a would-be entrepreneur that would like to set up a business to an actual business owner, what would that necessarily look like? And a lot of times you'll hear a lot of failure stories before you hear a lot of success stories. You'll find that there are innovators that are, generally traditional in their approach to business, where it's, a traditional mom and pop shop, or, you have innovators that are really harnessing a lot of the 21st century technologies, machine learning, really learning how to utilize the technology that is out here today and trying to commercialize a product that will be in the market and will be utilized for people, not only to earn money, but to also save lives and improve the lives of people. And so in terms of, that early stage support, what does that necessarily look like? And, there's gaps in the, in the maternal infant health support spaces, and there's also gaps in funding. And so it's definitely not an easy thing to pursue. It's not an easy route to take. Today, we'll talk a little bit about innovation fellows, and we'll talk about the CSIT products. But generally, women and minority-led startups historically have received less than 2% of venture capital funding. And so when we talk about early stage support and how to finance the commercialization of an actual product, how do you necessarily do that when there's all of these funding opportunities, some of which seem nearly accessible, and on the other side of that really double-edged sword, once you do receive, for example, something like venture capital funding, the stark reality is that 25 to 30% of startups backed by VC funding go on to fail, and 75% do not go on to even give back what they've actually earned. So in the absence of having the availability of investors, what do you necessarily have? And what you have, the option is your friends and family, your friends, your family, your fans. You have grant opportunities, and you have your non-dilutive options. I'll talk a little bit about New Jersey Innovation Fellows moving forward, but the New Jersey Innovation Fellows program helps to bridge the phase where early stage entrepreneurs face the most significant challenges, and that's really quite literally standing up their business. So what is the New Jersey Innovation Fellows program? So born from a $10 million state appropriation, approved teams can compete to receive up to $400,000 in startup capital for innovative business ideas. We provide the non-dilutive seed funding to serve as income replacement for entrepreneurs. And we deliver really a mentorship program to wrap around the entrepreneur teams that are approved to facilitate in the program. At the end of the day, we are an economic development agency. And so a lot of what we're doing is not only doing good for humanity in general, but we are facilitating economic growth and job creation within the state, particularly in those innovative ecosystems, particularly because, it really, it adds to the fact that New Jersey is a very innovative place, and there's a lot of opportunities to be able to pursue innovation because of our research facilities, because we are, necessarily a place where there's a lot of affluence. So it's certainly a good place to start a business. So breaking down, what the New Jersey Innovation Fellows Program is, again, it's a $400,000 grant program that's really supporting business ideas. You submit your business idea into our application, and really your business idea has to be, the core of your business idea has to have really three main components, and that has to do with our scoring criteria, which we'll talk a little bit later. But at the core, there's some eligibility requirements, and we'll also get into that momentarily. But in terms of what you may be eligible for the grant is that it's a $200,000 base if awarded. And then you are able to receive up to $200,000 in bonus awards as well. Bonus awards are correlated if an entrepreneur team lives in, if anybody on an entrepreneur team lives in an opportunity zone, a $50,000 bonus for a graduate of a New Jersey university, as well as a $50,000 bonus for any entrepreneur certifying as diverse or a woman. And so, again, the New Jersey Innovation Fellows Program seeks to really facilitate the entry and progression within the competitive landscape of New Jersey's ecosystem by providing that non-dilutive capital source for entrepreneurs on teams. And so back to, when we're trying to think about filling in gaps in maternal infant health outcomes, innovation fellows would necessarily serve as that starting capital to be able to get the business up and running, essentially. So the business idea necessarily does have to be in one of our targeted industries, which is a little bit different than the Commission on Science, Innovation, and Technology, which is really focused on life science. When we go back to this slide right here in terms of innovation, you have life science companies here, you have nutrition companies here, you have mental health companies here, technology companies. And so there's a number of different targeted industries that can actually, you can apply through Innovation Fellows through a number of targeted industries. It doesn't have to be maternal health, but we certainly would like, to have some maternal infant health startups that are trying to really show progress in this space. The business startup does have to be located in an eligible municipality as well. You can find the targeted industries as well as the eligible municipalities and really all of the program details on the New Jersey Innovation Fellows website. So in terms of the mentorship program, and really at the core, we're supporting entrepreneurs in two different ways. Not only is there income replacement attached to the grant, but there's also mentorship. Mentorship is a huge, huge piece of owning a business in general. Startups that generally have the networks and the guidance and the people around them to help, mitigate whatever mistakes you might make in the future. Very, very critical for an early stage company where you can't necessarily afford to make a bunch of mistakes. It's very time consuming, it's very costly. And so New Jersey Innovation Fellows Program really serves to also provide the mentorship to wrap around entrepreneurship teams so that they can, probe mentors on any questions that they might have or guidance. We do have two universities in which we facilitate the mentorship program through, and that is Rowan University Center for Innovation and Entrepreneurship, as well as the New Jersey Innovation Institute, NJIT. And so the general curriculum is in person as well as virtual. All of the entrepreneur teams that are approved into the program do have to participate in the mentorship program, but the focus areas are, a number of different areas in terms of capital sourcing and raising, learning about investors, understanding product design, customer discovery, managing, accounting and financial statements, all of those things. We've often heard it as like a mini MBA for some. And so in addition to the mentorship program, not only do you have, connection to the curriculum that is that is offered, but you also would be, the entrepreneurship team would also be partnered with an actual mentor as well, where you're able to, again, reach out to them for any, you know, subject matter specific questions about either your industry or marketing or customer development, whatever that is, that you would have a mentor to be able to ask and you know, see how you can really expand your business in a sense. And so we've talked a lot about, just at a very high level, you know, what Innovation Fellows is. I like to just present this slide because it gives really 7 bullet points around, you know, do you qualify for something like this? And so this gives you kind of a full picture of what we're necessarily looking for. And I won't go through the entire all of the bullets, but you guys can kind of take a look for yourselves, you know, what is all necessary. And again, all this information is on the New Jersey Innovation Fellows website. So what does the application process look like? Earlier, I may have mentioned that this is a competitive program, and we hadn't gone through it. We won't go through it again fully in this application or during this presentation, but really, you know, the application process for New Jersey Innovation Fellows consists of 3 parts. One, that qualifying questionnaire, making sure that everybody who is applying to the program, you know, on individual teams are qualified and they have complete applications. And then once that is kind of fine and dandy, you move on to the competitive scoring portion of the program. So with the competitive scoring, the rubric is online, but there's a total of 29 points available for the competitive scoring portion. After the competitive scoring portion, you have your 30-day registration period, meaning that if you are one of the startups that are within the top 8 of scores, you would necessarily be awarded, and after award or after notification of your award, you would then have 30 business to register your business. And so all applications to the program must include an online application as well as a business plan, an organizational chart so we know the individual team members of the startup, as well as their resumes, personal address documentation, and most importantly, proof of New Jersey gross income tax paid. If you have any questions about the application process itself, we do have frequently asked questions online that you're able to go to and see for yourself if you have any questions. Otherwise, our contact information will be in the back of this presentation for you all to review as well. And so in terms of the award disbursement and ongoing compliance, if you are awarded and accepted into the program, the award of the grant is distributed equally over 8 quarters upon, you know, following EDA approval and following submission of quarterly deliverables. And so every quarter we would necessarily review that you are really on track and in line with the mentorship program. You guys are still, you know, running your startups and so forth. And so this provides just a high level of some of the documents that we will be asking for every single quarter. At this time, applications are open and applications do close on Friday, July 5th at 5 p.m. Attached to the slide, you'll see all of the information related to the grading criteria, program frequently asked questions, eligibility questions, to the application itself, which is on the New Jersey Innovation Fellows website. And then full disclosure, there is a $250 non-refundable application fee due at the time of application submission. And again, if you have any questions concerning the program, please submit your questions to New Jersey Innovation Fellows at NJEDA.gov. So with that, I'm going to pass it over to Maku, who is going to talk a little bit about the Commission of Science, Innovation, and Technology, what they do, what she does, and how this contributes.
Thank you so much, Michelle. Good morning, everyone. I'm really thrilled to be here with this panel of amazing women, really talking about a pivotal topic. Again, my name is Maku Etta with the New Jersey Commission on Science, Innovation, and Technology. We are a sister agency to the EDA, and we really look forward to working very closely with Lisa and the Maternal and Infant Authority and the great work they're going to be doing. The commission is responsible for strengthening the innovation economy within the state, encouraging collaboration and connectivity between industry, academia, and the translation of innovation into really high growth businesses. We focus on inclusive engagement in the innovation economy, which is pivotal to this work and to this conversation. Many of our New Jersey registered companies that we've supported are developing, and it was shown in Michelle's slide of logos, many of them have leveraged our grants. They're developing innovations that are not only pivotal to the growth of the state's economy, but they're addressing very challenging medical access, which is a huge issue, information sharing, mental health challenges, issues facing our communities and our state as a whole. So we're really excited to be here. On the next slide, the commission really focuses on 3 elements. We are a linkage, first and foremost. We link entrepreneurs, research partners, industry, investors, and community partners. We do this through direct linkages, conversations, roundtable discussions. We also support a statewide platform called Research with New Jersey, where entrepreneurs have access to world-class faculty and research at 9 research institutions throughout the state. We support training opportunities. An example of this is our partnership with the New Jersey Small Business Development Center, where we support webinars where companies are provided information on federal resources such as the SBIR program. This is the Small Business Innovation Research Program offered by multiple federal agencies from NSF to NIH that are also addressing kind of disparities within various sectors, and life science and technology is one of them as it pertains to women's health. These webinars are, we co-facilitate some of these webinars and talk a little bit about some of the grant opportunities that we have. Our last area of focus, which is really the bulk of what we do, is we provide financial support in the form of early stage startup research and development grants. This is non-dilutive funding that our startup companies, our New Jersey registered startup companies can leverage. We support a suite of these programs, but for today, I'll focus on the maternal and infant health grant program. So on the next slide, when we launched the maternal and infant R&D grant program, the first round, it was really as a starting point to this very important conversation we're having today. How and where does innovation play a role in supporting the challenges that mothers and infants are facing in our state? And how can innovation really spur the solutions to many issues, again, across the medical field, across the medical plane, but also other issues that are not medically based, especially around access, information sharing, which many of our companies, our technology and AI companies are addressing. The first round of this program, we awarded 17 companies that are in the life science, technology, and non-retail food and beverage sector. These companies are doing amazing work, and we are excited that with a budget of a little over 1.5 million, we'll be able to launch a second round of this maternal and infant health program. Companies that apply for this program have to be New Jersey registered companies or with at least 50% of their staff working in New Jersey, less than 50 employees, have at least one full-time person, one full-time employee in the company, and they could be paid or unpaid. These are very early stage companies, so we understand that some companies have not reached the revenue mark yet. They must have less than 5 million in prior year revenue funding. And they also must be at least past a proof of concept. So companies that are that are in the R&D stage and past the ideation stage of this work. On the next slide, eligible applicants will be able to receive grants of up to $75,000. Each grant is roughly about 12 months. The objective, again, of this program is to support innovation from researchers and entrepreneurs focused on developing technology, therapeutics, and other solutions to address maternal and infant health challenges from the prenatal to 12 months, at least postpartum. Engage early stage innovation-based companies in New Jersey to accelerate research and development of technologies, to transfer these new discoveries from the research stage into commercially viable products and services that impact maternal and infant health. This grant is not a standalone initiative. It's really looking to layer the work of the authority, looking to layer the work of the EDA, and looking to really, again, bring this conversation to the forefront from a lens of innovation and how we can, as a state, leverage innovation to address some of the very challenging issues that we're facing here. And so we're really excited about this. The second round of the program, we're looking to launch this month. We have a date of June 17th scheduled for an application launch. All of the information is on our website at www.njeda.com/CSIT. We encourage all of you to review the notice of funding and also watch a webinar that we conducted on the program. And we're here and we're happy to have any further conversations with anyone who's interested in applying. Again, this is a small program, part of a larger initiative and conversation, and we're just really excited to be a part of this process. On the next slide is just, I believe, our contact information. If you have any questions on the program, on the role of CSIT, we're happy to answer any questions you may have. Thank you, and I'll pass it back to Pamela.
Thank you, Maku. Yes, that the CSIT partnership between EDA and now MIHIA is something that we're really excited about, and definitely check out those resources, share it if you know of any companies that kind of fit those sectors that Maku mentioned earlier. So I'm going to briefly talk about the Maternal and Infant Health Innovation Center. So earlier you heard from Lisa Asari, who's the new CEO and president of the Maternal Infant Health Authority that was recently established, and also known as MIHIA. And MIHIA will oversee long-term operations of the center, or the Maternal Infant Health Innovation Center. So just to give a little bit of backdrop of how the center or this idea came about, there is a Nurture NJ strategic plan, or out of the First Lady's office. She has a Nurture NJ plan, and that basically is to make New Jersey the safest and most equitable place to birth and raise a baby. Nurture NJ launched in 2019, and the strategic plan launched in 2021. There was a plethora of recommendations in the strategic plan, and one of those recommendations were to establish a maternal and infant health innovation center in the city of Trenton. So this strategic plan really looks on how we can advance maternal health equity and what that looks like. So the center will be a big part of that, and a part of the center, which will be built in Trenton, and I'll speak a little bit more about the location and what will be housed in the center, will be a space for incubation and innovation. And that will be kind of managed in partnership between EDA and the new Maternal and Infant Health Authority. So on the next slide, I'll speak a little bit about what you can expect the center to have. So the center will be a hub for multiple types of services pre- and postnatal clinical services, workforce development and the perinatal workforce, social service and wraparound supports, policy, research and data collaborative, and also, like I mentioned before, a space for innovation. So this is important in thinking long-term about where your work can be housed. So if, interested individuals on this call decide to apply for the NJ Fellowship Program, they can be a part of that for 2 years, and then maybe they can apply for a CSIT opportunity if it's available. And then once the center is here, we anticipate having space for those partners that are working in maternal health innovation to be housed in the center. So on the next slide, I'll dive more into the various aspects. So the previous slide, I kind of talked about overarching things that you can expect the center to have that will be located in Trenton. And the center will have 3 lead anchor tenants. So 3 lead anchor tenants that will focus on providing resources to the community, the residents of Trenton, but also the state at large. So we're going to have a lead healthcare clinical service provider, a lead institute of higher education, and then a multi-service organization. And these 3 entities are going to basically deliver the various services that we talked about on the previous slide. So you can, I'll speak more about that, what different services you can expect them to have, but I want to highlight that EDA recently awarded or announced that Capitol Health, Rutgers University, and Trenton Health Team will be our 3 lead anchor tenants. So we'll be working in partnership with them to offer services in the city of Trenton, which is really, really exciting. Something I want to mention too on the next slide is just the various things that each entity is charged with. So for our lead healthcare service provider, clinical service provider, which is Capitol Health, they're going to offer OB/GYN services, pediatric clinical services, mental and behavioral health services. Like we mentioned throughout this presentation, that postpartum care, after baby's here, we need to make sure mom's okay. They're going to offer lactation consultant services, community health workers, and telehealth services as well. Rutgers University, who came in as a consortia of 5 other schools, will train the perinatal workforce. So they're going to offer on-the-job training opportunities. They're going to have accredited degree programs and certification programs. And the goal of this entity and this specific anchor tenant is to diversify our perinatal workforce and to increase our perinatal workforce. We need additional, nurses that come from diverse backgrounds. We need community health workers. We need lactation support. We need doulas. So our Rutgers partner, who came in as a consortia with 5 other schools, will be heading that work in the center. And then Trenton Health Team, who is the multi-service organization, will offer those wraparound care coordination services. So on the next slide, I'm going to just speak a little bit on how we kind of, but before I do, how we arrive to those just specific services that each lead entity will have. But I want to just show you this. So we have the lead anchor partners, which we're really excited about. And then we also have the location. So EDA recently was approved, or the board recently approved EDA to begin negotiations to purchase the land known as the Battle Monument site or Battle Monument property, which is off Pennington and Warren Street. It's right across the Battle Monument in the city of Trenton, and it's near Henry J. Austin as well as Mount Zion. You could read more on that, the press release and things like that on our website. But on the next slide, I'm going to speak a little bit more about our community engagement work. So this is really where we root everything that we do. We root it in community engagement. We want to make sure that we're hearing the voices of our birthing individuals, our families, on what they need. And that's how we land it to the various services and the 3 lead anchor tenants that the center will house. So Kane University has the John S. Watson Institute for Urban Policy and Research, who is our community engagement partner. And the Watson Institute has been leading and holding interactive engaging conversations with moms and families about this center. So even before we had the site, even before we hammered down what we wanted to provide, we asked, what do you want to see? And they said, we want to see direct services. We want to make sure where we're going is safe and accessible. So the voices of women and their families were definitely ingrained in, the establishment of the center, and will continue to be involved as we progress in building the center and thus forth. So on the next slide, I just want to briefly mention the work that the Watts Institute has been doing. So they have 2 reports that they released, phase 1 and phase 2. And these reports basically capture the voices, stories, and experiences of Black women in the city of Trenton. And I think it's really a great read and very sobering as to why this work is important, like we've been mentioning throughout this presentation. We want to really create change in this space because a lot of these maternal outcomes that are negative are preventable. So we're really happy to, be hosting this call to partner with individuals who have innovative ideas, who want to move the marker in maternal health. So, the information on these reports is located on this slide. You can find them on our website and read up on the different things and experience that moms and families told us about. And I think it will really be impactful to you, as you read in things like that. And on the next slide, I think, that's the end. But if you all have any, questions, I can put my contact in the chat, or it will be available, once the slides are posted. But thank you all for, being here. We hope that you choose to do an innovative project in one of the sectors, but hopefully specific maternal health. Thank you. I'll pass it back over, I think, to Michelle.
Thank you, Pamela. Caitlin, I don't know if we had gotten any questions in our chat, or that if we're able to get some. I don't have access to that right now.
So yeah, so right now it doesn't look like there's any questions that have been entered, but
Caitlin, you're going in and out a lot.
Okay.
Yeah, I don't see any questions, but if anyone has any, feel free to ask.
Perhaps if there's anything in the chat, or I don't know if we're able to unmute folks. Anything?
There's a question about just the deadlines for applications in the Q&A. So I don't know if, Michelle, you want to start with the deadline for the Innovation Fellows program?
Yeah. For the Innovation Fellows, the deadline is July 5th for the second cohort. And announcements will be made later in the year about who is being awarded. Really closer to the fall, and we may or may not launch a 3rd cohort this year, but definitely to be determined in terms of Innovation Fellows.
Very good. And for the Maternal and Infant Health Grant Program, we're looking to launch on the 17th of June. It's typically about a 6-week program. So there is a notice of funding on our website. So it will probably close roughly around the kind of mid-August range. But you can take a look at that notice of funding to just really get all the details. There's another question around proof of concept for a technology that we have, they're building out, and are we seeking a minimum viable product when we submit our application? Well, for our grant, your proof of concept, that should be fine. Again, our proof of concepts can vary from a kind of peer-reviewed published paper to an SBIR. We've also received, if you are submitting for patent, kind of patent applications, or if you are developing a prototype of some type of sketch out. So, you know, it could be a variety of documents that we accept. We just really want to see that you have passed the idea stage and that there's been some background, there's been a little bit of research, possibly data that you've collected as you thought about your innovation.
There's another question here. Different one. Can applicants co-apply, like two companies wanting to work together on a maternal infant health grant, or does one organization have to be the lead?
Yeah, so for our grant, one company should be applying. Now you can partner with another company or external partner, and they can be written into your budget and from a support standpoint, but we typically receive one application from one company, and you do have to at least be the New Jersey registered company with at least 50% of your staff working in New Jersey.
And if I could just answer that for Innovation Fellows, because it's just got a lot of quirks with the program. The Innovation Fellows program supports teams of entrepreneurs. And so that means that half of which must be first-time entrepreneurs. And so it could be that individuals are, that have previously worked together that are, going to leave what they're necessarily doing to then jump into the startup ecosystem and, potentially the New Jersey Innovation Fellows Award. And so it's teams of people and really with a business idea or some kind of business concept that they would like to move forward. So as opposed to the CSIT grant where you have to have some level of proof of concept, this is quite literally at the idea stage. There hasn't been any formal funding. You might have some, drawings on a napkin at that point, no bank account, anything like that. But that it's kind of just in this ideation stage. And then the Innovation Fellows would actually assist you in setting up your business and the mentorship support to be able to progress through the program and then potentially obtain additional funding either through EDA or SBIR grants or something else.
Great. Thanks, Michelle. We have another question for the maternal program. Can we use funds to hire consultants from a firm to build out the technology?
Yeah, you absolutely can. Yeah, you can write in, again, external partners that are going to be a part of the R&D process. So that includes the building, testing, validation. That's absolutely fine. Mm-hmm.
Thanks, Michael. So we have another question. Says, what is the timeline for the completion of the building of the maternal and infant center in Trenton? And in the meantime, what work and collaborations will be occurring in preparation for that?
Right. So the physical building minimum, we're thinking 12 months to have like a shovel in the ground. And that's because we literally are building like a newly built establishment. So all the fixtures and things like that, it takes some time to just lay the foundation and lay the groundwork. So however, the 3 lead anchor tenants that I spoke about earlier will be involved in that kind of process of how the building should look as well as the community. So we're going to make sure we have community input, and then we also have input from the 3 lead anchor tenants on how that space would be fitted out. The 3 lead anchor tenants just got announced, and we started to meet with them now to talk about and discuss what can we do now while we wait for this physical building. What can we do now for the moms and families? So more info on that to come, but we look, hopefully to do things in the community, such as like community fairs or maybe some type of service that, moms can access, to help them get into and fro the grocery stores, whether that's Uber vouchers, Lyft vouchers, but none of those things have been hammered out just yet because the lead anchor tenants just got on board. So we're working in partnership with them to kind of firm out what we can do in the meantime as the center is being built.
Great, thanks, Pamela. This question is directed for maternal health. Are bonus points awarded to teams who were past Innovation Fellow recipients?
except for the maternal infant health grant.
That's right.
Yeah.
So we do provide, well, I think this is for you too, Michelle, because it says innovation fellows. But we could both answer. So we do provide bonus points for companies that apply and are eligible for the maternal and infant health grant. If you are in an opportunity zone or government restricted municipality, that's Trenton, Patterson, and Atlantic City. If you are a minority, women, veteran-owned company, if you have never received any CSIT grants or vouchers before, so you're a first-time kind of applicant, you receive a bonus point. And lastly, if you have technology that is licensed from a research institution, you receive bonus points. So there are several ways that you can receive a bonus point for our applications.
For New Jersey Innovation Fellows, you do not receive any additional points specifically for being in maternal and infant health. This is, today's presentation is really a calling to all of our partners across all targeted industries who may have some sort of nexus or may have some sort of interest or may have some sort of quite literal interest in positive maternal and infant health outcomes to be able to apply to the Innovation Fellows program, potentially fund their startup. And so there's no additional points you get for that and no additional monies, but we also have $400,000. And so it's quite a bit of money in that pot to be able to really pay for the salaries of the 3 individuals at minimum who are running the business. So I'm happy to continue having this conversation otherwise.
And we have one hand raised. Maggie, I don't know if we answered her question. Oh, okay, she lowered her. Okay, maybe we captured her question.
Yeah, we did. Okay, we have another question here regarding opportunity zones. Are they only in Trenton, Patterson, and Atlantic City, or does it go beyond that? Is there a map for them to check on opportunity zones for the maternal health program?
Yeah, no. So the opportunity zones are statewide. So they go beyond those 3 cities. Those 3 cities are considered also government restricted municipalities, which is a separate designation. So if you are in an opportunity zone throughout, which is a statewide, there is a map that we use. Or if you are also within these 3 government restricted municipalities, cities, you can you're eligible for that bonus point. If you receive the, based on the scoring, you do have to receive a minimum base score to receive your bonus points. So we first review the application, score the application, and those that receive that minimum score, they can then layer on the bonus points on top of that.
There is a map on the New Jersey Innovation Fellows website where you're able to go and quite literally put in your address for opportunity zones. And just to add a little bit more context, so the federal opportunity zones are quite literally not even just in New Jersey, but they're across the United States, and they are federally designated census tract blocks, literally. And so these are blocks within the United States that meet certain qualifications where if you're either living there, have a business there, you may be qualified for, you're really incentivized to live there and to have your business there because these are generally very, very, very low income communities. And so if you go onto the Innovation Fellows website, we do have a map where you can put your individual address there or an individual address there, and you can determine for yourself if that location is within a federally designated opportunity zone within New Jersey.
And thanks, Caitlin. She just added the links in the chat so everyone can go ahead and check those out. Thanks for all the great questions. There's no more in the queue. Okay,
great. Again, everybody has our contact information, and we will definitely circulate this video as well as the slide deck. Thank you all for your questions, and we really look forward to engaging with you all further. Feel free to reach out, and thank you all for today, and have a good rest of your week.
Great. Thanks, everyone.